Hello, everybody. My name is Cameron. I'm the Aflac representative for the Rolling Hills Country Club. The purpose of this video is to give you a very clear understanding of how these plans work. You may have seen the duck commercials, but they don't give a good understanding of how they work and how they help your life and all those things. So that's the purpose of the video. So please hang in there and listen in. I promise at the end you'll have a very clear understanding. You should have a packet, and inside the packet is a summary of plans with the rates, also an interest sheet, which I'll talk about in a second, and all of the brochures. If you don't have a packet, just check with your HR, and if they're out of them, I'll replay it. I'll restock them. Well, how does Aflac work? And it's really simple. It comes down to two simple things. If you were to have an accident or an illness or maternity, or your spouse, if you have one, or kids, you're going to have two basic problems. And the first one is you're going to have to be dealing with out-of-pocket medical expenses. That's going to get bigger and bigger as time goes on, but especially if it's something severe, you're going to be dealing with co-pays and deductibles and those kinds of things. You're going to have to be paying for stuff that you didn't anticipate you're going to be paying for. The second problem is that you may not be able to work if it's bad enough, and if you don't work, then you don't get paid. So at the same time that you have a dip in income, all of a sudden your living expenses have increased, and that is the biggest cause of bankruptcy in this country, medical bills. So the way Aflac works is that Aflac pays you cash directly, not the medical facility. So if you have a major medical problem, you go to the doctor, the hospital, or whatever, that health insurance kicks in, right? And pays the doctors in the hospital, but it doesn't pay us. So my health insurance has never sent me a check. So that's what Aflac is for. Aflac pays cash directly to you after an accident or after an illness. It does not matter what your other insurance covers or doesn't cover. These plans provide a safety net, a financial safety net, right at the moment that you need it. Some very important things about these plans that apply to all the plans is number one, the rates never go up. It doesn't matter how much you use it, they stay fixed, they roll over every year automatically. The other good thing is you can take this policy with you. So if you ever retire, go on to something else, you can keep these policies at the same discounted payroll rate that you got it at work. So it's always there in your back pocket. The only difference is it's not deducted from your check. It's paid for. You can set up a direct bill. You have 24/7 worldwide coverage. Doesn't matter if you're on the job, off the job, or traveling in another country. It doesn't matter. You are covered. You can set up direct deposit so that the money is deposited directly into your bank. And as I already stated, it doesn't matter what your other insurance what your other insurance is. Now, there are three plans available to you as an employee there. And as I said, you can pick and choose 1, 2, 3 plans. You think of this as a menu at a restaurant. There's three plans. They cover different situations and different scenarios. And you pick the ones or the combination of ones that best suit your needs. So let's go through each one of these plans very briefly so you get an understanding of how they work. The first plan is the famous accident plan. So this will pay you after any kind of accident. It could be on the job, off the job, traveling, doesn't matter. So it's based on what happened. It's totally based on the type of medical procedure you did. So there's several slides here of different types of medical procedures, and each one of these has a check for you. It's that simple. If it happened to you, you get paid. So it usually starts with the emergency room. The emergency treatment is like it's like a ER or a urgent care, or you bust a tooth and you go to a dentist or a chiropractor, any kind of thing where it's ouch, I got to go get this looked at. That kicks in between 125 to 205, depending if there's an x-ray, plus a per injury sum, and that ranges between $35 to $12,500, and that's based on how bad the accident is. There's different levels of accidents, and the more severe, the bigger the check. And then I'll skip down to the hospitalization because that's a very expensive part of healthcare. If you are hospitalized because of an accident, you will be paid $1,250 for the first day of hospitalization. Remember, that is a check to you, not to the hospital. It doesn't matter where the hospital is. It doesn't matter what your insurance covered. It pays you that. So lump sum, $1,250 for day one, and then it continues to pay you every day thereafter, $250 a day. So every single day you're in there, $250 after the first day, lump sum of $1,250. If it's an ICU, it pretty much doubles. And then as you can see in the slide, it has all these other benefits like diagnostic exams, ambulances, rehabilitation facility. Appliances are like wheelchairs, crutches, prosthetic, transportation. Now, accidental death life insurance. So if you die in an accident, then your beneficiaries will receive $40,000. That's a part of the plan. It's like having a life insurance policy built into this plan. And then if you're dismembered, up to $40,000, depending on which part is dismembered. And if you're in an organized sport, all these numbers increase by 25%. Now, the wellness benefit. If you do something for the wellness of your body, this plan will pay you $60 once a year. It's that simple. It renews every single year. And that covers pretty much the first 3 months of coverage. And you don't need any receipts. You just do it all online. You can even download the app. It has nothing to do with an accident. It's just a reward for doing something of the wellness of your body, like a physical exam or teeth cleanings or eye exam, very broad range of different types of wellnesses. So here are the biweekly rates. So this is exactly what would be taken out of your check if you choose to enroll. $15 as an individual. One parent family means you and all of your kids under the age of 26 are covered. Employee spouse means you and your spouse have the plan, but no kids. Two parent family means that everybody has the plan. Now remember, if you just file a wellness, that pays for the first 4 paychecks. Now, the next plan is the hospital plan. So the difference between the accident and hospital plan is the hospital plan covers illness and maternity, not just accidents. It's simple. It just pays a $1,000 lump sum per hospitalization. If you're ever hospitalized, either for an accident, illness, or maternity, it pays you $1,000. Remember, not the hospital. It pays you. Doesn't matter where the hospital is. There are 2 other options available. You can choose a $500 and a $2,000 per hospitalization. If you're interested in that and want to know how much it costs, just reach out to me. Now, once you're admitted to the hospital room, it pays $100, and then it pays you $100 a day while you're inside the room, and $500 a day if it's an intensive care ward, $100 a day if it's a rehabilitation unit, and if you're in there for less than 24 hours, it pays $100. So it's simple. Pay me if I'm hospitalized. Now, it has also all of these other benefits inside the plan that have nothing to do with being hospitalized. You go see a doctor. So think of this as a wellness visit or anything. It's going to pay you $25 per doctor visit. ER room, $100, lab tests, x-rays, MRIs, diagnostic exams, etc. You can read it for yourself. So there's lots of other benefits in the plan that don't have anything to do with being hospitalized. So that's the hospital plan. Here are the biweekly rates. As you can see, it depends on your age bracket. But again, once you are in an age bracket, you're locked in that rate forever. So even as you get older, it does not go up. It always stays the same. All right, let's talk about the last plan. I hope everybody will consider this plan. It's something that's near and dear to my heart. It's a very simple plan. It's a lump sum of $10,000 paid to you if you're ever diagnosed with a critical illness. And they're listed there, cancer being the big one, and heart attack, cardiac arrest, colon stroke. These are the bankrupting diseases. They cause a lot of financial disruption during a tough time. So to have a $10,000 check placed into your hands right after one of these things hits you is a lifesaver. It releases a lot of stress. Some very important things to understand about this plan. And number one, the rates never increase as you get older. You're about to see the rates, or if you have the sheet, you can see that it depends on how old you are. So the rate that you start with when you first enrolled is your rate forever. So if you're in your 20s or 30s, you can see how cheap it is. As you get older into the 40s and 50s, it stays the same. It doesn't go up, even if you take it with you if you leave your job. Aflac rates never go up. Your dependents are covered automatically for half of your lump sum. So if you have any kids, they're automatically covered for $5,000. Smoker rates are slightly higher. If you are a smoker, please reach out to me. I'll give you those rates, and includes a $3,000 or coronary artery bypass surgery. And there is a $20,000 and $30,000 option available. So just a heads up, if you're in your 20s and 30s, the rates between the 10,000 and the 20 and 30 is not that big. So reach out to me and I'll tell you how much it costs. Please consider that, especially if you're younger. So here are the biweekly rates. As you can see, as I said earlier, these are age banded. If you once you're locked in, if you're in your 20, say you're 25 and it costs $3.90. As you become 30, it doesn't go to 522. It stays at $3.90 forever. As I said, your children are covered for half of your lump sum. Now you go to the second column. That means your spouse is covered as well for half of your lump sum. So if you chose the 324, that's just you and dependents. If you have any kids, I mean, have any, 534 means you have a 10,000 coverage and your spouse and your children have 5,000 coverage. Hope that makes sense. Reach out to me if that doesn't make any sense. But again, I want to emphasize your rates are locked in. So if you're interested, how do you enroll? Inside that packet is a interest sheet. You simply fill it out, you turn it into HR, and then I will follow up with you with claim filing instructions, and I need to get a couple of things signed. So just fill that out, turn it in. This is my information, and my information is also in the packet. It's at the second page of the rate sheet. It's also at the bottom of the interest sheet. If you have any questions, if you want some advice, like which plan or plans to enroll in, feel free to reach out to me and I can help you out. So thank you very much for listening in. I appreciate it. I look forward to seeing everybody there in person.